Medical mistakes are the third leading cause of death in the U.S. and, according to my next guest, neither hospital error rates nor costs have come down, and Obamacare isn't helping things, it's making it worse. Here to explain, a surgeon at Hopkins Hospital and author of Unaccountable, What Hospitals Won't Tell You and How Transparency Can Revolutionize Healthcare, Dr. Marty Makary. Thanks for coming on this show. Dr. Marty, it's great to have you here. Let's start with some of these problems inside hospitals. People getting harmed by medical mistakes, people getting the wrong operations on the wrong side of their bodies. How is this continuing? How can this go on?
Well, you know, it's a problem that's been under the radar because the National Vital Statistics Department doesn't track medical mistakes as a cause of death, but it's the third leading cause of death. And if you look at the cost crisis in healthcare, the number one driver of the cost crisis is variations in quality. And unless we get a handle on this problem, we're not going to be able to rein in healthcare inflation. And that healthcare inflation directly gets passed on to everyday Americans.
It sure does. And taxpayers, we all pick up the tab, that's for sure. You say we have a health insurance cost crisis and that hospitals have gained monopoly power, and that's contributing to the issue. Explain.
Well, in the research that I did for this op-ed in today's Wall Street Journal, it's clear that some hospitals have monopoly power. Now, hospitals normally compete for the business of a health insurance company, but when they're the only show in town, they call the rules and they set the prices, often much higher. Those prices can only get passed on directly to the beneficiaries of the health insurance plan. There's nothing else the insurance company can do except pass that on in terms of higher premiums and higher copays.
Well, now, so I understand why prices are higher and how hospitals are controlling them, but does it also impact care?
Well, I think so. When there's only one monopoly power, the incentive to innovate or bring in best practices, I think, is diminished. And also, do we really want a few corporations controlling cancer care for half of Americans? What if they don't like a certain new medication or a surgical procedure, or they bought a proton beam therapy machine and they want to use it? So I don't think we want a few large corporations controlling all of the care in the United States. It's un-American and it doesn't promote competition. I think this country is great because of competition, and unfortunately, hospitals are going down the same road banks were going down before the financial crisis.
You know, I remember in Obamacare, there's something called accountable care organizations. Is this making this trend towards consolidation happen even faster?
You know, it's a big misinterpretation that we should form these massive monopolies. It's encouraged that we should have accountable care organizations in the law, but it's been sort of misunderstood to say, hey, because of this regulatory fear, let's consolidate, and there's more power in numbers. And what's happening is we're creating these massive conglomerates of hospitals. And in rural areas where there's only one hospital system for the entire half of the state, guess what's happening to prices? They're going up. So it's a concerning trend, and it's really a misunderstanding of what an ACO is. There can still be good competition and have accountability within a set of hospitals.
You know, the other story the Journal had today was that hospitals are abandoning rural areas, which is truly tragic. Marty, we're going to have to leave it there. Thank you so much for coming on the show. Really appreciate your time. Thank you.
Great to be with you.